Welcome, welcome, welcome. We're here to celebrate the strength, grace and faith that God has poured into each of us, but also to honor His gift of health by learning how to protect it. In the next few minutes, we'll shine a light on 4 important topics that touch every woman, either personally or through someone she loves. You might be wondering, what does a butterfly have to do with female health? I chose the butterfly because, much like a woman's journey, it undergoes a metamorphosis. Just as the butterfly transforms into a symbol of beauty and grace, women also experience a series of profound changes, physically, emotionally, and spiritually, as they age. These transformations are a testament to resilience, wisdom, and continual blossoming into their true selves. By understanding these seasons of a woman's body, how viruses like HPV can be prevented, how early detection saves lives in cervical cancer and breast cancer, and how to navigate the physical emotional changes of menopause, we equip ourselves and our sisters with knowledge, courage, and hope. Let's walk together in wisdom, asking God to guide our hearts and minds as we learn practical steps to keep our temples healthy and our spirits strong. This is just a disclaimer. This presentation is for informational purposes only. Every individual is unique and symptoms or experiences may vary. Please consult a qualified healthcare professional for personalized medical advice, diagnosis, and treatment options. Human papillomavirus, or HPV, is the most common sexually transmitted infection. Virtually everyone who is sexually active will be exposed at some point. There are about 200 related viruses, but fewer than 40 infect the anogenital tract and throat. Most HPV infections are asymptomatic and tend to clear on their own within 1 or 2 years. High-risk types such as HPV 16 and 18 are known to cause certain cancers, including cervical cancer. Lower risk types like HPV 6 and 11 may cause genital warts. It's important to note that warts caused by HPV are different from genital herpes, which is caused by the herpes simplex virus. They are not the same thing, and each requires a different treatment approaches. Understanding HPV and its implications is vital in protecting your health and preventing serious complications. HPV is primarily transmitted through skin-to-skin contact during vaginal, anal, or oral sex. While condoms can reduce the risk of transmission, they do not eliminate it entirely because HPV can infect areas not covered by the condom. Other factors that increase the risk of HPV infection include having multiple sexual partners, an early sexual debut, smoking, immunosuppression, and vertical transmission. Immunosuppression refers to a weakened immune system, which can occur due to certain medical conditions, medications, or treatments that reduce the body's ability to fight infections. When the immune system is suppressed, it's harder for the body to clear HPV infections. Vertical transmission means passing the infection from a mother to a baby during childbirth. Although it's rare, with HPV, it is a possible route of transmission. Understanding how HPV spreads helps in taking effective steps to protect yourself and your partners. The natural history of HPV begins with the exposure to the virus, which most often occurs through skin-to-skin contact during sexual activity. In most cases, about 90%, the infection is transient, meaning the body's immune system clears the virus naturally within 1 to 2 years. However, in some cases, the infection persists, especially with high-risk HPV types. Persistent infection can lead to precancerous cellular changes in the cervix or other areas. Over time, these cellular changes may develop into invasive cancer, often taking approximately 15 to 20 years to progress from initial infection to cancer. Understanding this progression highlights the importance of regular screening and early detection to prevent the development of cancer. Let's review some important information about HPV-related conditions. For genital warts caused by HPV type 6 and 11, the typical sites are the vulva, penis, and anus. These warts are usually benign and treatable. Cervical cancer, primarily caused by high-risk HPV type 16 and 18, accounts to about 70% of cases. It most commonly affects the cervix and is recognized as the fourth most common cancer in women worldwide. Other cancers linked to HPV include anal, vulvar, vaginal, penile, mouth, and throat cancers. These are associated with the various HPV types, including 16, 18, and 31, among others. Understanding these conditions helps us recognize the importance of prevention, early detection, and treatment to protect women's health. According to the 2019 data, the global burden of HPV-related cancers is significant. Women face approximately 620,000 new cases each year, while men account for around 70,000 new cases. Cervical cancer is a major HPV-related female cancer, representing a substantial percentage of HPV-associated cancers in women worldwide. The highest prevalence of cervical HPV infection is found in the sub-Saharan Africa, with rates reaching up to 24%. Other regions with notable prevalence include Latin America and the Caribbean at 16%, and Eastern European and Southeast Asia at 14%. This data highlights the importance of prevention, vaccination, and screening efforts to reduce global impact of HPV-related cancers. Certain groups of women are at higher risk and more vulnerable to HPV and related cancers. This includes women living with HIV, as their immune systems are compromised, making it harder to clear infection. Men who have sex with other men also face increased risk due to high prevalence of HPV in these populations. Immunocompromised individuals, such as transplant recipients, are more susceptible because their immune defenses are weakened. Individuals with other sexually transmitted infections are also at greater risk, as STIs can facilitate HPV transmission and persistence. Finally, survivors of sexual abuse may be at increased vulnerability, emphasizing the importance of supportive care and screening for all these groups. Signs and symptoms of HPV-related conditions can often be absent, especially in the early stages. Genital warts typically appear as cauliflower-like lesions, which may cause itching, bleeding, or discomfort. Cervical precancer is usually asymptomatic, meaning it shows no noticeable symptoms, which is why regular screening is crucial for early detection. Cervical cancer may present with bleeding after sexual intercourse, intermenstrual bleeding, foul-smelling discharge, or other site-specific symptoms, such as persistent sore throat. Since many of these conditions can be silent in the early stages, screening is vital to catch precancerous changes before they develop into invasive cancer. Prevention of HPV through vaccination is a key strategy. The World Health Organization pre-qualified vaccines that protect against high-risk HPV types, primarily types 16 and 18, which are responsible for the majority of HPV-related cancers. The primary target group for vaccination is girls aged between 9 and 14 years, ideally before the onset of sexual activities. Boys can also get HPV, so it is beneficial that they also get the HPV vaccination. For immunocompetent individuals, the vaccine is administered in 2 doses spaced 6 months apart. In immunocompromised persons, a 3-dose schedule is recommended for optimal protection. The HPV vaccine is safe. It contains no live viruses or viral DNA. Common adverse effects are mild and include pain or swelling at the injection site, fever, or headache. Serious adverse effects are very, very rare. Overall, the benefits of the vaccination far outweigh the minimal risks, making it a safe and effective tool in preventing HPV-related diseases. HPV screening and early treatment are crucial in preventing cervical cancer, the only HPV-associated cancer with effective screening methods. The World Health Organization recommends HPV DNA testing every 5 to 10 years, starting at the age of 30 or at the age of 25 for women living with HIV. If the test is positive, further evaluation is done through visual inspection with acetic acid, VIA, or colposcopy. Acetic acid is a clear colorless liquid that has a very strong vinegar odor, and a colposcopy is an exam that looks closely at the cervix. They do this with a specialized magnifying instrument. If precancerous lesions are identified, they can be treated with procedures such as thermal ablation or loop electrosurgical excision procedures, known as LEEP. Thermal ablation involves applying a heat to destroy abnormal cervical tissue, usually with a device that uses electrical current or heat. LEEP is a procedure that uses a loop wire heated by an electric current to remove abnormal tissue from the cervix for further examination or treatment. In addition to screening, lifestyle modifications can further reduce risks, including smoking cessation, consistent condom use, and male circumcision, which have been shown to lower the likelihood of HPV transmission and related cancers. Management of HPV-related diseases focuses on treating the conditions caused by the virus, as there is currently no cure for the viral infection itself. Genital warts are commonly treated with procedures such as cryotherapy, which involves freezing the warts with liquid nitrogen to destroy the abnormal tissue. Topical agents are medications applied directly to the warts or precancerous areas, which help to eliminate their lesions. For precancerous cervical changes, treatment options include ablation, using methods like thermal or laser energy to destroy abnormal tissue, or excision, which involves surgically removing the abnormal tissue, such as through LEEP. In cases of invasive cancers, management involves a multidisciplinary approach, including surgery to remove the tumor, radiotherapy to target the cancerous cells, chemotherapy using drugs to kill cancer cells, and immunotherapy, which boosts the body's immune system to fight the cancer. Early diagnosis and prompt treatment are vital, as they dramatically improve survival rates and outcomes for women with HPV-related diseases. HPV is a common infection, but it's largely preventable through vaccinations and screenings. With sustained efforts, we can eliminate cervical cancer within decades. However, the burden of HPV-related diseases is highest where the health services are the weakest. A collective effort is essential, involving governments, health workers, educators, and civil society working together to ensure access, prevention, and care for all. We can help by sharing this knowledge we have on HPV, making others aware. Cervical cancer, prevention, early detection, and support. Cervical cancer is a leading cause of cancer-related deaths among women in South Africa. Its high prevalence is closely linked to HPV infection, compounded by limited access to screening and vaccination services. This highlights the importance of a comprehensive approach that includes prevention through vaccination, early detection via screening, and robust support systems for women affected by the disease. Together, these strategies are essential to reduce the burden of cervical cancer and save lives. The epidemiology of cervical cancer in South Africa shows a significant burden, with approximately 14,000 new cases diagnosed each year. The disease also results in an estimated 6,000 deaths annually. Key risk factors include persistent HPV infection and co-infection with HIV. Socioeconomic factors such as income, education, and access to healthcare also influence the risk and outcomes of cervical cancer. HIV-positive women have a higher risk of developing cervical cancer due to their weakened immune system, which makes it harder for the body to clear HPV infections. Addressing these factors through comprehensive prevention, screening, and treatment is essential to reduce the impact of cervical cancer in South Africa. Prevention strategies against HPV and cervical cancers include vaccination, which was incorporated into the National Immunization Program in 2014. The vaccination targets girls aged between 9 and 14 years old, ideally before sexual debut, to maximize protection. It effectively reduces the risk of infection with high-risk HPV types that are most associated with cervical cancer. In addition to vaccination, practicing safe sexual behaviors is crucial. This includes consistent condom use, limiting the number of sexual partners, and education on HPV transmission. Together, these strategies play a vital role in preventing HPV infection and reducing the burden of cervical cancer. Early detection and screening are vital in the fight against cervical cancer. Screening methods include pap smears, which is cytology-based testing, meaning it examines the cells of the cervix under microscope to detect abnormal changes. Another method is visual inspection with acetic acid, or VIA, where acetic acid vinegar is applied to the cervix to highlight abnormal areas. HPV DNA testing detects the presence of high-risk HPV types in cervical cells, helping identify women at risk of developing cervical cancer. Screening guidelines recommend that women aged 25 to 49 undergo pap smears every 10 years, or more frequently if they are at increased risk. Women living with HIV should be screened every 3 years, or as recommended by their healthcare provider. Regular screening enables early detection and treatment, significantly reducing the risk of progression to cervical cancers. Support and treatment for HPV-related diseases involve various options depending on the stage and the condition. For precancerous lesions, one common treatment is cryotherapy, which involves freezing abnormal cervical tissues with liquid nitrogen to destroy it. Another procedure is LEAP or loop electrical surgical excision procedure, where a wire loop is heated by electrical current and is used to remove abnormal tissue from the cervix for diagnosis or treatment. For invasive cancers, treatment options include surgery to remove the tumor and radiotherapy using high-energy radiation to kill cancer cells. Psychosocial support is also essential. Counseling services, support groups, and non-government organizations provide emotional and psychological assistance to patients and their families. Patient navigation programs help patients assess appropriate treatment services and ensure proper follow-up, improving overall outcomes. In conclusion, cervical cancer is both preventable and treatable through effective strategies. Early detection saves lives, highlighting the importance of regular screening and prompt treatment. Continued investment in vaccination screening programs and support services is essential to reduce the burden of cervical cancer in South Africa. Together, through these efforts, we can save lives and build a healthier future for women everywhere. Breast cancer awareness. Breast cancer is one of the most common cancers among women worldwide and in South Africa. Early detection saves lives. Monthly self-examinations are simple, free, and empower women to spot any changes or abnormalities early. Regular awareness and proactive screening are key steps to reducing impact of breast cancer. Why is self-examination important? It helps detect lumps or changes early when they are most treatable. By understanding what your breasts normally look like and feel like, you can notice any unusual changes promptly. If you notice any abnormalities, seek medical consultation without delay. Self-examination also increases awareness and helps reduce stigma, that is, the negative attitudes or discriminations associated with breast health issues, encouraging women to take proactive steps for their health. When should women start breast self-examinations and how often? Women should begin self-examinations at the age of 20. It is recommended to perform the exam monthly, ideally a few days after your period ends, when breasts are less tender and lumpy. If you are not on a period due to menopause or have had a hysterectomy, choose a specific day each month, such as the first or last day of the month, to perform the exam consistently. Regular self-examination helps you become familiar with your breasts and detect any changes early. How to perform a self-examination step by step. Look at your breasts in the mirror with your shoulders straight and your arms on your hips. Check for any changes in size, shape or symmetry. Look for dimpling or puckering of the skin, redness or other skin changes. Also observe the nipple changes or discharges. Lie down and examine your breasts using the pads of your fingers in circular motions, covering all areas, upper chest, ribs, underarms and collarbone. Feel for lumps or thickening by applying different pressures, light, medium and deep, to detect any abnormalities. Performing this self-exam regularly helps you become familiar with your breasts and notice any early signs of changes. What changes should you be looking for? New lumps or thickening of the breast or underarm area, changes in size and shape of breasts, skin changes such as redness, puckering or dimpling, nipple changes including discharge or inversion, persistent pain or discomfort in the breast or nipple area. Noticing any signs warrants prompt medical consultation for further evaluation. When should you see a doctor? If you notice any new lumps or changes in your breasts, seek medical attention if you experience persistent pain or nipple discharge. Regular checkups and mammograms are important. These should be performed every 2 years starting from the age of 40 or is recommended by your healthcare provider. Early evaluation and screening are vital for detecting any issues early and ensuring your breast health. Additional tips for breast health include maintaining a healthy lifestyle, eating balanced diet, exercising regularly, and limiting alcohol consumption. Know your family history, as some breast cancers are linked to genetics. Utilize local resources such as the South African National Cancer Registry, breast clinics, and mobile screening units like the Pink Bus. These resources can help with screening, education, and early detection, empowering you to take charge of your breast health. In conclusion, regular self-exams can save lives. Stay informed and vigilant about your breast health. Early detection leads to better outcomes and more treatment options. Remember to share this important knowledge with family and friends to help save lives and promote awareness. Menopause. Understanding your body's changes. Over 1.1 billion women worldwide will experience menopause in the next 10 years. Many symptoms go unnoticed or are misunderstood. Recognizing these signs can help you feel like yourself again. Are you ready to take control of your health and start this new chapter with confidence? Hot flashes are sudden waves of heat that appear out of nowhere. They affect up to 50% of women during menopause. These episodes may include feelings of flushing, sweating, and sometimes anxiety. Hot flashes are caused by increased sensitivity in the hypothalamus, the part of the brain that regulates body temperature, due to declining estrogen levels. Recent research suggests that targeted neural treatments, which are therapies aimed at specific nerves or brain areas involved in temperature regulation, may help reduce hot flashes in the future. Night sweats involve waking up drenched in sweat, even when you're feeling cool. Hormonal shifts can confuse your body's thermostat, leading to these episodes. Night sweats can disrupt sleep, affecting mood, memory, and energy levels. They are linked to lower levels of estradiol, a form of estrogen, which is a hormone that helps regulate many functions of the body. Your body is signaling a natural transition through these symptoms, indicating the menopausal process. Sleep disturbances are common during menopause, with many women waking up wide awake at 3 a.m. and struggling to get back to sleep. Hormonal changes can disrupt your sleep cycle, making it harder to stay asleep through the night. Night sweats and hot flashes can also disturb deep sleep stages. These episodes cause sudden increases in body temperature and sweating, which can make you wake up and prevent restful sleep. Between 40 to 60% of menopausal women experience sleep issues. Understanding how hormones affect your sleep can help you find strategies to restore restful nights and improve your quality of life. Mood swings during menopause can include feelings of irritability or tearfulness. These changes are linked to drops of estrogen, which affect mood-related brain chemicals. Estrogen receptors in emotional areas of the brain become more reactive during this time. You're not alone. These changes are backed by science and are a normal part of the menopausal transition. Memory problems, such as forgetting why you entered a room, or recent conversations are common during menopause, especially in perimenopause. Declining estrogen levels can affect cognitive functions, including memory, concentration, and mental clarity. Stress can also worsen these symptoms by impacting your brain's ability to process and recall information. It's important to recognize these as temporary biological changes. Your body is adjusting to hormonal shifts. Practicing stress management, staying mentally active, and maintaining a healthy lifestyle can help support your cognitive health during these transitions. Fatigue during menopause often manifests as a persistent tiredness and low energy. Hormonal shifts can impair cellular energy production, leaving you feeling exhausted. Heavy menstrual bleeding may also lead to iron deficiency, which further contributes to fatigue. Restoring energy levels involves understanding these biological factors and addressing them through proper health care and lifestyle adjustments. Thinning hair is a common concern during menopause, with hair becoming finer, thinner, and shedding more than usual. Declining estrogen levels reduce hormones that support hair growth, leading to changes in hair density and texture. This hair loss is a natural part of aging and hormonal transition, but it can be managed through various treatments, such as topical therapies, proper nutrition, and medical advice. Understanding that these changes are normal can help you feel more empowered to seek appropriate solutions and maintain your confidence. Empower yourself during menopause. While menopause brings changes, remember that knowledge is power. Recognize the symptoms and seek personalized care that suits your unique needs. Support your health and well-being through informed choices, open communication with healthcare providers, and self-care practices. Remember, you're not alone. Help and support are available to guide you through this transition. Taking control of your health can lead to healthier, more confident you. Understanding HPV, cervical cancer, breast cancer, and menopause empowers you to take control of your health. Early detection, awareness of symptoms, and seeking professional guidance are essential steps in maintaining your well-being through these important life stages. Remember, knowledge is power. Never hesitate to seek medical advice when needed. For more information, resources, or to revisit this presentation, please visit our website at www.oshecare.co.za. Stay informed, stay healthy, and take charge of your health journey. Together, we can support each other, living healthier, happier lives. Thank you for taking the time to attend this presentation. I hope you've learned something new today that can make a meaningful difference in your health and well-being. Please feel free to share this knowledge with other ladies, mothers, sisters, daughters, friends, so that we can all support each other, staying informed and healthy. Together we can make a positive impact on our lives and communities.